My name is Evita James. Healthcare delivery is changing quickly, and this is because of artificial intelligence and a growing aging population. Healthcare organizations will need confident leaders at every level who have knowledge, skills, and abilities to guide their teams through change. Skilled leaders can motivate their teams to take ownership of tasks and goals at the grassroots level where it matters the most. Leaders are not simply born this way. However, they can develop these skills by becoming goal oriented, by building self confidence, and by strengthening their internal motivation to learn at every turn. Healthcare leadership depends on a strong electronic human resource management, which begins with recruitment of talented, skilled workforce, which is technologically savvy. Therefore, HR leadership must be equally prepared with technology that allows the workforce to thrive. Emerging trends qualify cutting edge organizations as those that make investments in human resource technology. These trends include specific platforms that allow for the recruitment and talent acquisition that can streamline the recruitment process by automating job posting, applicant tracking, and resume screening. Other examples are platforms that allow employees onboarding, which can facilitate their digital orientation materials, training modules, and company policies for new and existing workforce. Although emerging human resource technology has shown benefits, it may not always be inclusive. For example, a qualified worker who lacks access to technology or does not yet have strong technology skills could benefit from an ARch platform that includes onboarding tools that can help bridge the gap between workers who already have technology skills and qualified workers who need support building those skills. The increasing aging population will accentuate healthcare shortage moving towards 2030, when the youngest baby boomer will turn 66 years old. Many state governments have already prepared by unlocking nurse practitioners and physician assistants into independent practice, which do not necessitate the co-signing of a medical doctor. Will this be enough? Do international medical doctors need credentials to provide telemedicine to patients in the US? How can these physicians be unlocked to provide telemedicine or even in person medical care without meeting the rigors of medical training of US physicians? While these questions are being sorted out, the World Health Organization has developed a code of conduct with the aim to protect poor countries from deteriorating medical care resulting from the demand of skilled workforce in richer countries. The Code of Conduct provides an important ethical framework to ensure that international migration of healthcare professionals is organized responsibly for both countries of origin and the destination country. In 2030, the goals of Triple Aim will continue to have a seat at the table. Innovations will cater to patient-centered demand fueled by AI. Higher education and medical schools specifically will incorporate the use of AI more broadly while finding innovative ways for the learning process goals to be reached. Now back to those questions I posed earlier. Items that are thought as challenges today will likely be easily engineered by AI in the future. For example, building capacity for access to affordable care could be increased by aligning international physicians willing to perform telemedicine for US patients. Evaluation and intervention prescribed by an international physician would be analyzed by the use of AI and by parameters that lend validity to the intervention whether it is pharmaceutical or surgical. This system of care could decrease wait times for new visits, thereby reaching a diagnosis sooner and a treatment plan. In this system, medical doctors and primary care physicians could become consultants, and mid level providers and international physicians would then be referring providers. By providing telemedicine, international physicians gain a better understanding of the US medical system. Ethically, It allows international physicians to continue their work within their local community and is consistent with the code of ethics as prescribed by the World Health Organization. Thank you for your time, and I will see you in 2030.